Let's trace the historical timeline of national health insurance in South Africa, focusing on key events. 1994. The Healthcare Finance Committee recommended that formerly employed individuals and their immediate dependents should initially form the core membership of social health insurance arrangements. The goal was to expand coverage to other groups over time. 1994. South Africa also saw the transition from South Africa's National Party government, who had ruled the country since 1948 and had advocated the apartheid system for most of its history, to the African National Congress, who had been outlawed in South Africa since the 1950s for its opposition to apartheid. 1995. The Commission of Inquiry on National Health Insurance supported the 1994 Committee's recommendations, emphasizing primary healthcare services. 1997. The Social Health Insurance Working Group developed the regulatory framework leading to the enactment of the Medical Schemes Act. Despite this, national population coverage remained below 16%. 2002. The Committee of Inquiry into Comprehensive Social Security recommended mandatory cover for formal sector workers above a tax threshold. It also proposed creating a national health fund to channel resources to public facilities. 2009, the Advisory Committee on NHI formed. 2011, the Department of Health released a policy paper titled NHI in South Africa for public consultation, the Green Paper. The Green Paper is a government policy discussion paper that details specific issues and then points out possible causes of action in terms of policy and legislation. It articulates possible solutions that are yet to be adopted by government. At that time, there were 3 phases proposed. Phase 1, 2012 to 2017, the piloting of and the development of systems and processes for the effective functioning of the health system. Phase 2, 2017 to 2022, will entail the development of systems and processes to ensure effective functioning and administration of the NHI fund. These reforms are categorized into 4 items: financing, health service provision, governance, and regulatory. Phase 3, 2021 to 2025, will be the introduction of mandatory prepayment for the NHI, contracting for accredited private hospital and specialist services, finalization and implementation of the Medical Schemes Act, and finalization and implementation of the NHI Act. In addition to the specific activities that the CMS will be carrying out in Phase 2. 2015, the White Paper. This white paper lays the foundation for moving South Africa towards universal health coverage through the implementation of national health insurance and establishment of the unified health system. 2018, NHI Draft Bill. The Minister of Health invites interested parties to submit written comments on the proposed draft National Health Insurance Bill. 2019, the NHI Bill was introduced to Parliament, aiming for universal health coverage. Over time, Phase 2 concludes and Phase 3 is initiated. 2023. The NHI Bill was passed by the National Assembly on June 13, 2023, and by the National Council of Provinces on December 6, 2023.
Questions that we want to answer. The first question is, what does NHI simply mean for you and I in the country, as medical aid members, as South African citizens? So government intends, moving some of or all of that money in tax relief into the public spend and utilizing that to improve state infrastructure. In short, Joanne, the idea is for both private and public to work together. And not breaking one system at the expense of the other.
We're going to centralize in Section 32 the national budgets of the government. One health budget. We haven't had that since 1993 When was it? 96 was the last year we had one health budget. 97 we've had 10 health budgets. So on day one, what can I pay for with the fund? Well, I can pay for primary healthcare, I can pay for this, I can pay for that. Where do I get that money from? Well, I get it from the provincial equitable share and the conditional grants. I get it out of what's currently spent in the correctional services. I get it out of wherever it's currently sitting in the public service.
2024, President Cyril Ramaphosa signed the NHI bill into law, with implementation planned in 2 stages between 2024 and 2028. So what now?
What is required is that almost 51-52%, which is used for only 15% of the population, must be integrated to be fully utilized for the whole population.
Now, preparations for the implementation of NHI necessarily requires a focused drive to improve the quality of healthcare. We have already begun implementing a national quality improvement plan in public and private healthcare facilities, and we are now seeing vast improvement.
Facilitated by Dr. Manda Chifularo. Join ASI Financial Services to discuss how your business can navigate NHI and the future of healthcare in South Africa. We are pleased to welcome Professor Nicholas Crisp, Deputy Director General of the National Health Insurance, as he provides insight into the implementation of the NHI bill. Additionally, we'll be joined by Dr. Rajesh Patel, Head of the Health System Strengthening Department at the Board of Healthcare Funders, and Dr. Stan Mulwabi, Principal Officer at the Government Employees Medical Scheme. The discussion will focus on the current and future scenarios that your business may encounter, as well as practical models and solutions that your business may adopt for your employees and their families. Our experts will share invaluable insights, answer your pressing questions, and chart the way forward. Don't miss this opportunity to stay informed and ready for the changes ahead. For more information, speak to ASI, your trusted independent employee benefits and insurance advisor, or visit asi.co.za to find out how we can help you. ASI, building wealth, changing lives.